Joss from the Pura Vida Clinic. So today I want to touch a little bit again on frozen shoulder and a couple of exercises that you may find useful regarding this condition. So there are a couple of exercises that I tend to reach for. The first one is an isometric exercise. Essentially this exercise is a static one, so you're not actually moving the shoulder, but you are getting the muscles around the shoulder activated, you are getting them working, and research has shown that this can help desensitize some of those structures, so help from a pain management point of view. So the first exercise, as I said, is a static one. What I tend to do is I have my arm hanging in a neutral position, so this is an area, a range that feels comfortable for you. And what you're going to want to do is find a surface. I'm using the side of the plinth here, and I'm just trying to push my arm across my body. So I'm going to push, and I try and find a level that I'm comfortable with and that I can maintain. I'm going to hold that for about 6 seconds. And then I have a little rest, and I'm going to repeat that for 5 cycles. Once I've completed that, I'm going to flip the way I'm standing, and I'm going to go to the other side of the plinth. So now instead of pushing across my body, I'm pushing away from my body. So same thing, I'm going to push against the plinth. I'm going to hold that for 6 seconds. I'm going to have a second break, and I'm going to repeat that for 5 cycles. So this is the starting exercise that I tend to use for this condition. As you saw, there's a limited movement happening at the shoulder, but you are getting the muscles working, which can help desensitize things from a pain perspective. Now, the second exercise I tend to use is the pendulum exercise. So you're going to need a little weight. I usually use something about a kilo, and you're sort of supporting your body here. You want that shoulder in a nice neutral position. So this shouldn't be pushing into those areas that are really causing a lot of pain or a lot of guarding in the shoulder, okay? And all you're going to do is use your body to generate a little bit of kinetic swing and just create a little bit of a circle through that area. And we're not pushing up against those end ranges of position. I'm not pushing into things where the muscle's cramping down or trying to protect it. It's just keeping it nice and easy. It's a nice light exercise. So those are the 2 exercises I tend to reach for regarding this condition. If you have any questions or want to reach out about your case, feel free to email the clinic for a call back from one of our practitioners. We provide osteopathic care to Reigate, Redhill, Merstham, Dorking and surrounding areas. And if you're in the vicinity and need help, do reach out.